Good evening, everyone. During a clinical skills session in my second year of medical school, we had to interview a patient who was recently diagnosed with an endocrine illness at AUBMC, but who was misdiagnosed for 16 years before coming into our medical center. His diagnosis led to multiple complications, including vertebral fractures, and his misdiagnosis could have been prevented with a simple calcium level. After knowing that the patient was illiterate and of a very poor financial background, I wondered whom I should reach out to for help. It was then that I first contacted Dr. Arawi to help me found a student-led program that enrolls volunteers in fundraising activities to support patients in need of healthcare. This was how Khilkhal was born. Through Khilkhal, we managed to assist the patient in covering his medications for more than a year, and we enrolled him in an Arabic teaching course to help him read and write. We named the initiative Khilkhal as those who wear the khilkhal are daring people. The khilkhal also leaves a sound and an imprint, and this is what we do in khilkhal. We dare, we inspire, and we leave an imprint. And this is, today, 3 years later, khilkhal became one of the biggest volunteering programs at AUB, AUBMC, and Lebanon, with over 400 volunteers from AUB, Balamand, USG, NDU, City College of New York, and others. Our volunteers are pre-medical, medical, undergraduate, graduate students, and MDs coming from Lebanon, Syria, Palestine, Jordan, and the USA. As the founding director of the Salim Al-Hus Bioethics and Professionalism Program at AUBMC, who adopted Khilkhal, Dr. Arawi helped us carry out activities to enhance fundraising, to enhance humanism and compassion towards patients and our community as a whole. She supported us in implementing fundraising activities, books, clothes drives, and other activities where volunteers were involved in cooking, preparing food boxes, distributing holiday meals to needy families, cleaning and reconstruction campaigns after Beirut blast to rebuild what was left of our beloved country. Dr. Arawi has guided us, among many other medical students, to be the virtuous physicians of the future. I wouldn't imagine Towards a Post-Flexnerian Revolution, a book that calls for integrating medical ethics in medical education and graduating virtuous physicians would be written by any other than her. Dr. Arawi, congratulations on your book. I have been honored to meet you and to work with you and to have been mentored by you.